Let's talk about acute kidney injury, or AKI, and its management. A must-know for every healthcare professional working in acute care, ICU, or nephrology. Acute kidney injury is a common yet serious complication that can arise in hospitalized patients, especially in critical care settings. Quick recognition and evidence-based management are essential to prevent long-term renal damage or fatal outcomes. Let's define what is an acute kidney injury. This is a rapid or abrupt decline in kidney function and subsequent dysregulation of the body electrolytes and volume and abnormal retention of nitrogenous waste. AKI management, according to the CADIGO guidelines, or the Kidney Disease Improving Global Outcomes, covering the following. Identification and diagnosis, based on serum creatinine and urine output. Immediate priorities, addressing pre-renal, intrinsic, and post-renal causes. Supportive care, managing fluids, electrolytes, acidosis, and more. Avoiding nephrotoxic agents that worsen renal function. Essential monitoring for creatinine, urine output, and weight changes. Dialysis indications using the mnemonic AEIOU. Acidosis, electrolyte abnormalities, intoxication, overload, and uremia. Let's discuss each KDIGO guideline, starting with the identification and diagnosis based on serum creatinine and urine output. Definition of AKI using KDIGO criteria. First is rise in serum creatinine by more than 0.3 milligram per deciliter within 48 hours. Or an increase in creatinine to 1.5 times baseline within 7 days is a clinical criterion for diagnosing acute kidney injury, AKI. And a urine output less than 0.5 milliliter per kilogram per hour for 6 hours is a sign of oliguria, which can be a sign of acute kidney injury. Let's discuss the next guideline, which is the immediate priorities, addressing pre-renal, intrinsic, and post-renal causes. Pre-renal, which is addressing volume depletion and hypotension. Pre-renal AKI, also known as pre-renal azotemia, is a type of acute kidney injury caused by reduced blood flow to the kidneys, leading to a temporary decrease in kidney function. It's characterized by decreased renal perfusion, which can stem from various factors like hypovolemia. Heart failure, also known as congestive heart failure, occurs when the heart muscle can't pump enough blood to meet the body's needs. Or renal artery stenosis. The key feature is that the kidneys themselves are not damaged, and function typically returns with correction of the underlying issue. Now, let's discuss the intrinsic part, which is acute tubular necrosis, or ATN, and glomerulonephritis. These are distinct kidney conditions, though both can lead to acute kidney injury, or AKI. ATN is characterized by damage to the kidney tubules, often due to ischemia or toxics. Glomerulonephritis, on the other hand, involves inflammation of the glomeruli, the filtering units of the kidney. Both can lead to a sudden decline in kidney function. Acute tubular necrosis, or ATN, is primarily caused by ischemia, lack of blood flow, or nephrotoxins, substances toxic to the kidney. Glomerulonephritis can be caused by infections, autoimmune diseases, and medications or toxins. And lastly, postrenal obstruction. Postrenal obstruction refers to any blockage in the urinary tract that occurs after the kidneys, such as in the ureters, bladder, or urethra. This obstruction prevents urine from leaving the kidneys and can lead to a buildup of pressure, potentially causing acute kidney injury, AKI. Common causes include kidney stones, enlarged prostate or benign prostatic hyperplasia, tumors, and urethral strictures. Now let's discuss supportive care, managing fluids, electrolytes, acidosis, and more. Ensuring proper hydration is essential. If acute kidney injury is due to dehydration, intravenous fluids may be administered. If fluid overload is present, diuretics may be used to help the body eliminate excess fluid. Acute kidney injury can disrupt electrolyte levels like potassium and calcium. Medications or dialysis may be needed to correct imbalances. Maintaining adequate blood pressure is important for kidney perfusion. Medications may be used to control blood pressure, and vasopressors might be necessary in some cases. A healthy diet is important for overall health and can help support kidney function. A registered dietitian can help create a personalized meal plan. In cases of severe acute kidney failure, where the kidneys are unable to maintain essential functions, dialysis may be necessary to remove waste products and excess fluid from the blood. Another key principle under KDIGO guideline is avoiding nephrotoxic agents that worsen renal function. Nephrotoxic medications can elicit damage to the kidney via various mechanisms, including alteration in its structure and function. Nephrotoxic agents that you need to stop or avoid are the following. Yes, NSAIDs or non-steroidal anti-inflammatory drugs can be nephrotoxic, meaning they can potentially cause kidney damage. NSAID-induced acute kidney injury is often reversible if the medication is stopped promptly. Another example is IV isotonic fluids. Although isotonic saline is not inherently toxic to the kidneys in the same way that certain medications, it can indirectly contribute to kidney injury in certain situations, particularly when used in large volumes or in patients with pre-existing kidney issues. Judicious use of isotonic fluids, along with careful monitoring and consideration of other factors, is crucial in managing acute kidney injury and preventing further kidney damage. Next are AC inhibitors, or angiotensin-converting enzyme inhibitors, and ARBs, or angiotensin receptor blockers. While AC inhibitors and ARBs are not generally considered nephrotoxic, they can sometimes lead to a temporary decline in kidney function, reversible glomerular filtration rate, or GFR, in certain situations. This effect is usually hemodynamic and not due to structural damage. However, they can contribute to acute kidney injury, or AKI, when combined with other medications or in specific patient populations. The risk of AKI from ACE and ARBs is increased when combined with other medications that affect kidney function, such as NSAIDs and diuretics. Next is the essential monitoring for creatinine, urine output, and weight changes is crucial for assessing kidney function and fluid balance. These parameters help in the diagnosis and management of various conditions, including acute and chronic kidney disease, heart failure, and fluid retention. Regular monitoring allows for timely interventions and adjustments in treatment plans. Daily monitoring of labs consisting of serum creatinine, electrolytes, BUN, and urinalysis are commonly ordered to assess kidney function. These tests help evaluate how well the kidneys are filtering waste products, maintaining fluid and electrolyte balance, and producing urine. Essential monitoring of input or output, urine output hourly if critically ill. In critically ill patients, hourly urine output is a crucial indicator of kidney function and overall fluid balance. A normal hourly urine output is generally considered to be 0.5 to 1.5 milliliter per kilogram per hour. Critically ill patients may have reduced urine output, oliguria, which can be an early sign of acute kidney injury, AKI, or other complications. Hourly urine output monitoring is essential for timely intervention and management in these patients. And lastly, dialysis indications using the mnemonic AEIOU. The mnemonic AEIOU is used to remember the indications for dialysis, particularly in cases of acute kidney injury, AKI. It stands for acidosis, electrolyte imbalance, specifically hyperkalemia, intoxication, certain drug overdoses, overload, volume overload, and uremia, symptoms like encephalopathy or pericarditis. Early recognition and intervention are key. Don't wait for creatinine to rise significantly. Urine output is often your first signal of trouble. Decreased urine output is an earlier and more sensitive indicator of potential kidney problems than a significant rise in creatinine levels. In other words, monitoring urine output is crucial for detecting early signs of kidney injury or dysfunction, even before creatinine levels become noticeably elevated. I hope you have learned something on how to manage acute kidney injury, or AKI. Remember, detect early, protect kidney health.